My name is Navid Jallali. I'm a consultant plastic and reconstructive surgeon. I had an inkling when I was about 7 years old. Bizarrely, I remember distinctively watching a video of a surgery on TV. And from that point at the age of 7, I got hooked on surgery. I always wanted to be a surgeon, and part of my job is to help people. And really, I went into medicine to try to help people and do surgery. And my final decision on plastic surgery actually came about in a roundabout way. I initially wanted to become a cardiac surgeon, and I spent a year doing general surgery. I was really fortunate enough to work with one of the greatest plastic surgeons of our era, and this came about entirely by chance. His junior doctor got hurt in an accident, and I got to fill the post. And I got to work with him, and he inspired me to become a plastic surgeon. I really loved microsurgery, which is a very delicate procedure where we transfer tissue from one area of the body to another, and it involves essentially stitching blood vessels under a microscope together. And I really got hooked on microsurgery, and that's really why I became a plastic and reconstructive surgeon. I grew up in Iran. I left Iran when I was 13 years old and came to England. And I studied initially was brought up in Bournemouth. I then went to Bristol University. And from there, I moved to London, initially to Cambridge, and then to London, where I did my higher surgical training. And I eventually got a consultant post in Charing Cross Hospital, which is in central London. I think it goes back to trying to help people. What I do is help people to get, have reconstructions following the cancer treatment, or I help people to go back to a body state that they want to get to. A lot of my work involves abdominoplasties and breast reductions, and as well as having a cosmetic component to these operations, there's a huge functional benefit to these in terms of patient being able to go back to work, patient being able to go and exercise, they should be able to do things that they've not been able to do because of the limitations that their body puts on them. So really the best part of my job is to try to help people to get to where they need to.